Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
There are some local ablative therapies for liver secondaries. So what are the local ablative therapies which are available for liver secondaries? So first technique is called as freezing. Actually, by freezing, we have a technique called cryotherapy can be done for liver secondaries. In cryotherapies, actually, we will freeze the tissues, and this is done if the it is mainly done if the zone if the it is done if the zone of necrosis is around 3 to 5 centimeters. Then you do a cryotherapy. Advantages of cryotherapy are, so if we see the advantages, cryotherapy is important because especially whenever there is large zone of necrosis is seen, um, so in such cases it is advantage, it is good, and it is also easily followed by necrosis also. Then if you see the disadvantage, now how are you going to do cryotherapy for a liver secondaries? For that, first and foremost, you should do a laparotomy and you should put a probe inside it. So it requires a laparotomy, and large size probe insertion is also required. So these are the disadvantages of cryotherapy. Then second ablative therapy is radiofrequency or microwave ablation. In radiofrequency or microwave ablation, actually in this procedure, in radiofrequency or microwave ablation, the main mechanism of action is these microwaves or radiofrequency waves, they cause necrosis, that is, they cause hyperthermic coagulative necrosis. And the zone of necrosis which is seen in this zone of necrosis is around 2 centimeters. Okay, what is the advantage of this technique? This uh, radio frequency ablation or microwave ablation is a percutaneous technique, so it has good advantage. Then what about the disadvantage? Here this percutaneous sorry this radio frequency ablation or microwave ablation, here small sized necrosis is seen in radio frequency or microwave ablation. Then we have ethanol acetic acid or chemotherapy or hot saline. This ethanol acetic acid chemotherapy and hot saline, here the main mechanism of action is by local injection therapy. We give a local injection is given, and here mainly the zone of necrosis here is almost 3 centimeters. And the advantage of ethanol acetic acid or chemotherapy or hot saline is simple, inexpensive. It is simple and inexpensive therapy, but the disadvantage is it can result in homogeneous distribution. Inhomogeneous distribution will occur, which is a disadvantage.
thank you and thank you for watching.